So today's video is all about treating back acne. Why does it happen? The best ingredients to use, how those products work on your skin, the best product options for skin of color, and at the end I'll be giving you a step-by-step routine on how to treat your skin. If that sounds good to you, please give me a thumbs up. With skin of color, it's very important to classify your acne. The reason being that if it's mild acne, it's unlikely to scar. But if you have moderate to severe acne in skin of color, you're likely to hyperpigment. I see a lot of this in my clinic at the Hyperpigmentation Clinic. Here are some before and after photos of back acne at my clinic. Now, the aim is to not get the pigmentation in the first place, so that's why it's important to classify. If you have white heads and black heads, these are classified as mild acne, and they're unlikely to scar. So mild acne consists of black heads and white heads. Black heads are basically a hair follicle, a clogged hair follicle that has oxidized oil inside, and that's why it looks dark. A white head is basically the same thing, but with the skin closed on top. So those two resolve by themselves and you don't need to worry about them. Now, when you have pustular acne, that's basically when pus forms under the skin. It can be troublesome aesthetically, it can be painful, and it can lead to bacterial infection. Now, back acne that's pustular is actually a sign of acne vulgaris. The reason this happens is fourfold. One, hormonal changes, increased stress, improper diet, and neglect of skincare. So what do we do about it? You want to reduce excess sebum, you want to unclog the pores, you want to restore the normal pH of the skin, which is about 4 to 5.5, and you want to reduce the inflammation on the skin. This is essential for skin of color. So how do we treat it? Your number one ingredient you want to be using is benzoyl peroxide. This basically is an antibacterial, so it kills the bacteria, but it also breaks up the lesion. Now, the mistake people make with this is they'll use it when they have the acne or when they see the acne, and then they stop using it and the acne comes back again. They use it cyclically. You have to use it consistently. And when you use it, make sure you leave it on the skin for 2 to 5 minutes, then you wash it off, and you do it daily. Now, with skin of color, we have to be careful because it can be quite irritating at higher percentages. You can buy benzoyl peroxide at 10%. However, I wouldn't recommend that for skin of color. The maximum I would recommend is about 5.3%. At that percentage, it's still just as effective, but without the irritation. So that's very important to note. In addition, you can combine the benzoyl peroxide with differin, and the brand name is adapalene. This is basically 0.1% retinoid. So you can use it in a moisturizer after you've had a shower and you've got dry skin. You can use a back applicator in order to be a bit more effective and make sure you're actually targeting the lesions. In the shower, do not scrub the skin. I know you want to, it's very irritating having a lesion and all you want to do is scratch, but you are basically aggravating the skin, you are removing that barrier, and what ends up happening is more transepidermal water loss, which will lead to inflammation, which can lead to another flare-up. So please don't do this in the shower. Another few notes for you is don't reuse towels. Try and wash your bedding often because you get bacterial buildup, and that can lead to more acne later. A few other things is I would avoid fabric softeners and bar soaps. Soap bars basically have solidifying agents in them, which can also lead to another flare-up. The other thing I would note is your water. I would use a water softening tank, or there are lots of devices you can do to soften your water, because hard water can actually change the composition of oil in your skin and can also aggravate acne. So these are a few things that you can do to help yourself at home. Black mud is another ingredient I recommend. It's an anti-inflammatory and it's an antibacterial. So this is important for acne. Sulfur is another great ingredient. It's anti-inflammatory, it mops up sebum, and it's antibacterial as well. You'll often find tea tree oil as well in your products because it works on P. acnes, which is the bacteria that causes acne, and it also normalizes your sebaceous glands, which is part of the reason you get the acne in the first place. Lastly is niacinamide. Niacinamide is anti-inflammatory and it's soothing. So you definitely want to have this in your skincare routine, especially if you've got skin of color, because it's one of the few that is actually not going to irritate your skin. So well done for getting to this point. That was all the hard science, the hardcore science, and this is the easy bit, the step-by-step tutorial on what you need to do. So first thing I would do is make sure you wash your body with different 5% benzoyl peroxide thoroughly, and then on alternate nights or alternate days I would use salicylic acid 2% body wash. So I quite like Paula's Choice or Alba Botanica. Both of them I'll link for you in the description box. After you step out of the shower, make sure you dry your skin thoroughly, and then I would recommend using Acne X Cream. It's the one in the green jar, and that has basically got salicylic acid in it, niacinamide. It's also got dipanthenol in it, which is soothing and an antibacterial. It's also got licorice extract in it, which is important for the pigmentation that can be left behind after you get a spot. Now, if you feel like you're getting moderate to severe acne in skin of color, it's essential you go and visit your dermatologist quickly. The difference between Caucasian and skin of color is Caucasian skin can have severe cystic acne and won't be left with any pigmentation afterwards. With people with skin of color, one spot, one bite, one burn, we pigment. And then, you know, it's a whole issue trying to treat the pigmentation. The dream is to not get the pigmentation in the first place. And so what I would say is if you've got children and, you know, they're going through puberty and they're starting to get acne, get them seen earlier rather than later, because often people find that the pigmentation is more traumatic than the actual acne itself. So that's my key tip. Make sure you download your free ebook for Skin of Color. I put a lot of love and effort into it, so I hope you enjoy it. Please do subscribe and hit the notification bell for weekly teaching on Skin of Color. If you've enjoyed today, please write yes in the box below so I know I'm on the right track for you. And if there's anything else you want me to make for you, please write it down below as well. Thank you for listening.